Good morning, everyone. Welcome to our webinar for today entitled PSW Updates on Technician Resources and Roles in Wisconsin. Thanks for joining us. My name is Erica Martin and I am a PSW staff member. So today we are going to go over a variety of resources for PSW members. First, I'll provide information on PSW, the technician section, technician product verification, and a training program available to technicians. Then PSW staff member Danielle Womack will review technician registration legislation and the technician immunization administration statutory changes. Then PSW staff member Jane Barton will discuss PSW's technician immunization training, upcoming PSW conferences, and a technician career ladder podcast series. Followed by that will be Carrie Trapskin, also a PSW staff member, who will provide information on technicians and the Wisconsin Pharmacy Quality Collaborative and community health workers. We'll then end with a few minutes where you can ask questions. Feel free to type those in the chat throughout the presentation today, and we'll get to them at the end of all the slides. This webinar is being recorded right now for those who are unable to attend, and a link to it will be shared in PSW Communications. So with that, we'll get started. All right, so first we'll discuss PSW and the technician section. Today, with more than 4,200 members statewide and in all practice settings, PSW is the professional organization for pharmacists, pharmacy technicians, and student pharmacists to join to further their careers and improve the care of patients in Wisconsin. We offer first-rate education, networking opportunities, business solutions, inspirational stories, and offer ways to make a difference at PSW. So that is what we are about. PSW is designed so that its members can work together and help one another and advance the pharmacy profession with the singular purpose of enhancing the lives of people in Wisconsin. PSW's mission is to provide a unified voice, resources, and leadership to advance the pharmacy profession and improve the quality of medication use in Wisconsin. PSW's vision is that at PSW, we collaborate with healthcare teams to improve medication use, health of Wisconsinites, and transform pharmacy practice. PSW's diversity, equity, and inclusion statement is one voice, one vision for all. PSW supports diversity in our membership, equity in our opportunities, and inclusiveness in our organization. We embrace our differences, unifying efforts to enhance patient care while advancing our profession. Our patients are diverse, and so are we. PSW's strategic plan includes a breakthrough initiative related to pharmacy technicians. It says that Wisconsin will have a quality pharmacy technician workforce that is empowered to take on advanced roles. If you're interested in reading more about the PSW strategic plan or just about PSW in general, please visit the PSW website. Within PSW, there's a section specially for technicians. There are approximately 900 technician members who work in all settings throughout the state of Wisconsin that are members of PSW and the technician section. The section is overseen by a board of technician section members. The board provides governance and insights to the section and PSW. If you're interested in serving on the board of the technician section, please complete the interest survey, which is sent out in PSW Communications each spring. PSW also recognizes one outstanding technician each year with the PSW Technician of the Year Award. Nominations for this award are also collected each spring, and information can be found on the PSW website and through PSW Communications. As a member of PSW, you can get connected through various different routes of communication. Our primary source of information is PSW's weekly newsletter titled Fast Facts. It is sent out every Friday morning, and in Fast Facts, you'll find pertinent updates, but also announcements on how you can express interest in serving on the technician section board or nominating a person for the Technician of the Year Award. Other places you can connect with PSW are the Journal of the Pharmacy Society of Wisconsin, which is published bi-monthly. We also have the PSW website, our Facebook page, Twitter, Instagram, LinkedIn, YouTube, and a new PSW podcast channel. We also have a resource called PSW Network, which was coming soon. Information on connecting with these different communication channels is on the screen. Next, let's talk about technician product verification. So technician product verification is also commonly called Tech Check Tech. Technician product verification expands the roles of pharmacy technicians. Trained and validated pharmacy technicians complete the product verification, while pharmacists continue clinical review of medications. Technician product verification is permissible in Wisconsin in both the outpatient and inpatient settings. To use technician product verification in your pharmacy, you must follow Wisconsin state requirements. This includes certain policies and procedures, appointing a supervising pharmacist to oversee technician product verification, following the requirements for eligible medications and also eligible technicians to participate, following the requirements for didactic training, practical training curriculum, and the practical training using artificial airs. You must also complete a validation process and have ongoing quality assurance measures. Finally, you must do record keeping and reporting requirements and also work to increase direct patient care. So to help you with implementing all these different steps and requirements, PSW has a technician product verification toolkit. It includes directions and templates for smooth implementation. The toolkit is applicable to both the outpatient and inpatient settings, and you can find the toolkit online. Lastly, I want to provide information on a resource for training to take the PTCB Certified Pharmacy Technician exam. So PSW suggests using Pass Assured, an online technician training program. PTCB requires that technicians who are interested in taking their Certified Pharmacy Technician exam, they must take a recognized training program prior to registering for the test. Pass Assured is recognized with PTCB as a prerequisite training course. So completing Pass Assured will allow you to sit for the PTCB Certified Pharmacy Technician exam. You can also use this as prep work for the NHA Accept exam, or if you just need some general training on technician work. So to sign up, visit passassured.com, click sign up, and then select Wisconsin as your state. And then you'll just need to complete some personal information so that you can access the program. So now I will turn this presentation over to Danielle.
Thanks, Erica. Thanks for joining us, everybody. The first thing that I want to update everybody on is some legislation relating to pharmacy technician registration. Erica, could you advance the slide? So Wisconsin currently is one of just 4 states with no legal recognition of our technicians. It's Wisconsin, New York, Hawaii, and I believe Colorado is the last state. And they have no, like I said, they have no legal recognition of technicians. Our technicians aren't licensed, they're not registered either. So registration would give the Pharmacy Examining Board oversight of technicians, just like they currently have for pharmacists and pharmacies, and just like the State Department of Safety and Professional Services has for countless other healthcare professions. It would require technicians to be 18 years or older with a high school diploma or a GED or in a high school apprenticeship program. It also requires technicians to pass a background check, and the fee would be $60 every 2 years, which is equal to or less than all of our neighboring states. This bill has been introduced and it's had a public hearing in the legislature. It's still working its way through the process. If it were to pass, it would be implemented in about a year. Next slide. And then the next thing I want to give an update on are some changes relating to pharmacy technician immunization administration. Next slide. So under the pandemic, there were a number of waivers and variances and amendments to the PrEP Act and all sorts of other things that allowed in different cases technicians to administer vaccines. But recently a new piece of legislation was actually passed and signed into law in Wisconsin that's permanent. It's not tied to the pandemic in any way, and it allows certified, trained, and supervised technicians to administer any vaccine per ACIP to patients 6 and older. So when we say certified, we mean by either PTCB or NHA. When we say trained, we mean they have to have 2 hours of immunization training and either basic life support or CPR. And when we say supervised, they have to be supervised by a pharmacist who's trained in immunization. This new law also allows pharmacy techs who are trained in immunization to administer epinephrine or diphenhydramine in the case of a vaccine reaction. And you don't need a protocol or a standing order or prescription or anything like that. And that's only for an adverse vaccine reaction. Our website has a training course that does meet the requirements of the law. And again, this allowance is permanent. It's not tied to the pandemic. And next. So with that, I'm going to pass it off to Jane.
All right. Hi, everybody. I think this might be the first time that I am speaking to a larger group of PSW technician members. Some of you might know me because I've been around for a little while. I've been working with PSW since January now as an employee, but I served as the technician section president back in 2018. So I definitely probably would recognize some of you if I could see you. So my name is Jane Barton, and I am the Senior Manager of Educational Services and Professional Engagement here. And I'm really excited to be speaking to all of you on this technician webinar. You obviously all have a very special place in my heart. So to start off talking about the Technician Immunization Administration training, really just dovetailing off of what Danielle just said. So she was speaking about the legal changes, which are now allowing certified technicians in the state of Wisconsin to immunize. And again, just to reiterate, this is not necessarily tied to the pandemic. It might have started in the pandemic, but this is something that will continue on, as we move through flu season and things like that. So we have a training here at PSW, Technician Immunization Administration training, that does meet the requirements of the state of Wisconsin. You can find it on our website. So this is how you can become certified to immunize. It does meet those requirements of 2 hours of training, and then an assessment that actually happens at your home site where you can sort of practice and make sure that your skills are up to par. So the requirements are that you complete 3 online modules. So everything is online. It's concepts and terminology, safety and administration, and then product handling and storage. So everything is run through our Lecture Panda online. Then you have to pass a final exam with 80% correct. Then you have to pass an immunization skills assessment. This is going to be scored by an immunization certified pharmacist at your home site. So you don't have to do that part over Zoom. And as Danielle mentioned before, you do have to be CPR or basic life support certification required. That's part of the law. And this does not occur through PSW. So you would either want to work through your employer for that, or there's various different resources in your community where you can get trained to do that. So our website has a ton of information on it. I really encourage you guys, if you haven't before, to play around a little bit with our online CE modules and also some of the technician resources that we have online. So if you're interested in the technician immunization delivery, you can go to the education tab, then click on online CE, search technician immunization delivery. The cost is $175 for members and $275 for non-members. I will say that right now we are working with PTCB to get our program acknowledged as being a training program to sit for your immunization administration, immunization administration certificate. So that's like an add-on certificate. If you are PTCB certified, it's kind of like a badge that you can get added on. So we're in the process of getting this approved to qualify for that. All right, and if anybody has any questions about the technician administration training, you can absolutely reach out to me. It's jbarton@pswi.org. You can find my information on the website too. So pivoting a little bit, talking about upcoming PSW conferences. So the next conference that we have is our yearly annual meeting. So it's September 17th and 18th in Green Bay, Wisconsin. So on Friday, we have 4 forums to choose from: health system, ambulatory care, community pharmacy, and leadership development. And then we also have a welcome back reception in Lambeau, sort of a welcome back to in-person. So speaking of in-person, this is a bit of a hybrid conference. So we're sort of taking that first step back towards meeting in person. So we are going to have virtual content as well. We're going to be recording some of our live sessions that you can then use for continuing education. And we're also going to have a lot of sessions that are only recorded. So they're pre-recorded in advance that you'll be able to access as well. On Saturday, we have our keynote speakers. So these are kind of like the big general session where everybody's together watching a session. So I'll have 2 of those. An advocacy briefing from Danielle, poster session, additional breakout programming. So that's more continuing education. We'll have the president's reception and awards banquet, which is kind of our big fancy banquet that we have. So that's the annual meeting. And then of course we have the technician forum. Many of you have probably been to this before. It's a great opportunity to get together, network with other technicians, and also get your continuing education. We also usually have some pretty good food too. So it's November 5th and 6th in La Crosse, Wisconsin this year at the Radisson on the River. Friday evening, we'll have some sort of networking event. This is still pretty far in advance, so there's like a lot of things that we're still, trying to hammer out. But then Saturday, we'll have some all-day programming. One of my favorite things about the Technician Forum is how many of our members of our technician section actually get involved with presenting. So we can accredit presentations from our technicians to qualify for continuing education. So if you have a project that you've worked on, or there's something about your position that you think would be really valuable for other technicians to know about and understand, maybe you work with USP 797, or maybe you have a new career ladder at your place of employment, let us know, because that might be something that would be really valuable for other technicians to learn about. The other thing that I want to say about annual meeting and the Technician Forum, really any of our meetings, we have some really great resources online. If you go to education and then conferences, if you actually click on the Technician Forum, it's going to take you to a web page that will tell you about the Technician Forum, but it will also give you some additional resources that the Technician Section Board made a few years ago about how to inquire with your employer if they would support you in going to one of these. So not just, hey, will you help me pay for my hotel room, or would you help me pay for the conference attendance fee? But also, can I get that day off, right? So those kind of things. So there's some letter templates in there, some email templates in there. If you're not sure how to ask your employer, we've got some good resources in there as well. All right. And then the other thing that I want to talk to you about is this exciting project that we're working on right now. It's actually sponsored by PTCD, and it's called the Technician Career Ladder Podcast, or we call it Climbing the Ladder. So what we're doing is we're going around and interviewing multiple different practice sites. We've got some health system in there, some local pharmacies, community pharmacies, retail, and we are basically asking them how they have expanded technician roles. And we have a leader in every call, so a managing pharmacist, and then a couple of technicians who can speak to what the experience has been like for them. So really what we're trying to do with this project is sort of like open up that black box. So you might hear, oh, wow, this system is doing really great things. How did they do that? We don't need every site to recreate the wheel. It would be really great if we could share some of these ideas about technician advancement so we can sort of move everybody together at once. So we've got interviews with Wisconsin pharmacies for best practices. So far, we're working with Gunderson, UW Health, Froedtert, O'Connell, Struz, and Boscobel. So kind of what's your next move? So listening to these podcasts, they should be published on August 1st. and you can find out more. I'm taking you guys on a little tour of the website here. You can find out more if you go to communications and then PSW podcast. And again, it should be posted August 1st. And with that, I will give it over to Carrie.
You're muted, Carrie.
Thank you so much. Let me try that again. I got my camera, but not my volume. Good morning, everybody. Thanks for joining us. My name is Carrie Trapskin, and I'm a pharmacist here at the Pharmacy Society of Wisconsin. I work extensively on the Wisconsin Pharmacy Quality Collaborative, which is an initiative of PSW that we've been working on for over 10 years, over 13 years, over 14 years. We've been working on this for a very long time. And technicians are a crucial part of this medication therapy management program called the Wisconsin Pharmacy Quality Collaborative, or WPQC. Oops. There we go. So first of all, I'll just give you a tiny history on WPQC. We work with primarily at this point with the Wisconsin Medicaid program. So over 1/5 of our state's population is eligible for, so over 1 million members of our state's population are eligible patients to receive comprehensive medication reviews from pharmacists. So really a sit-down medication review, but now can also be provided via telehealth to really look at all of the patient's medications and connect with their physicians and other healthcare providers to make sure that they're doing the best that they can with their medications, maybe adding more appropriate medications, making recommendations for that, maybe discontinuing some medications that are not needed or that are too expensive and could be replaced with something else. Lots of different ways that the pharmacist can help to optimize that person's medication regimen. So in addition to pharmacists being able to go through a certification process to become WPQC certified, technicians can also become certified as a WPQC certified technician. So if you go to our website under membership, you'll find the information about becoming WPQC certified as a technician. There's a home study training program that's 5 hours long, and you get 5 hours of continuing education credit, which can go towards your continuing education credit for if you're a certified technician. You basically do the home study online, and once you're completed, you need to get a 70% completion rate on the test, and then you're good to go. It costs $20 a year for PSW members and $50 a year for non-members. What's good about it is that you then become an extension of the pharmacist at the pharmacy, and we do know that pharmacies that have technicians involved in the WPQC program are the pharmacies that really excel in providing the most comprehensive medication reviews and are serving the most number of Medicaid patients across the state. They're also the ones that are involved more in some of the local projects that we have going on around medication therapy management. Okay, so the foundations of the WPQC program, there are 2 types of services, level 1 services and level 2 services. I mentioned those sit-down comprehensive medication reviews where the patient receives a comprehensive list of updated of their medications that include their over-the-counter medicines, their supplement medications that they may be taking, as well as prescription medications. So the pharmacist is really trying to compile all the medications that one person may be taking. Maybe if they might not be all from the same pharmacy, but really trying to get a good picture of what that patient is taking. Level 1 services are not always reimbursed. In particular from the state Medicaid program, they are not reimbursed. However, They're super important to, and really the backbone of the comprehensive medication review, because the level 1 services are the intervention recommendations that are made. So they're the types of things that the pharmacy can take care of, and maybe technicians are really the backbone of that as well. So making sure that recommendations that are communicated to physician offices are followed up upon, communicated back to the patient, et cetera. So in addition to the activities that are medication therapy management related, technicians can also become advocates for another really important part of the WPQC program, and those are related to the quality-based best practices. So there's 7 best practices in place: brief medication history, having a continuous quality improvement program in place in the pharmacy to detect and prevent medication near misses and errors from happening in the pharmacy, using 2 unique identifiers to identify that you have the correct patient, allergies and adverse drug reaction checking, pediatric dose checking, identifying those FDA med safety alerts that come through almost daily, and making sure that anybody on those medications knows the risks, and then correct product dispensing and patient engagement. So all of these things have ways that technicians can support these really important quality-based best practices. And these are things that the pharmacy gets a quality assurance survey and completes every 6 months in order to maintain their accreditation with the program. So I just want to spend a couple of minutes going through the different types of patient activity and clinical service support that the pharmacy technician can be really instrumental in for the WPQC program. So again, the CMRA is the Comprehensive Medication Review and Assessment service. And technicians can help to identify the patients that qualify for these services. They can contact the DAPO Center or the Prior Authorization Center for Medicaid patients to make sure that those patients are identified as eligible and sort of reserved for those services at your pharmacy. They can do a lot of the preparation prior to the visit, so contacting the patient, providing reminder calls, preparing medical records requests, whether that be electronically or via fax, helping to get EMR access, read-only access in the pharmacy, contacting other pharmacies to find out the other medications that maybe they're filling elsewhere, entering the medication list into a documentation platform, and then of course, welcoming that patient and directing them to the appointment just prior to the comprehensive medication review. During the CMR, they can provide the patient with an estimate of the approximate length of time in the visit, which really helps to set the stage to make sure that folks know how long the visit is supposed to last. Gather preliminary information from the patient, so can really act as a medical assistant in this situation. So asking what the goals that the patient has for the visit are, what are their concerns, figuring out the basic demographics that need to be documented, who their healthcare providers are, and caregiver information. They can also work on updating the medication list, including, as I mentioned earlier, those over-the-counter medications and supplements that are so important that we know about. And then following the comprehensive medication review service, the technician can be super important in providing a time check for the pharmacist. So this is kind of near the end of the comprehensive med review, really helping to keep that time and everybody on schedule. So knocking on the door when the predetermined time has been reached, so that it may help to redirect the conversation. And these are visits that usually last 45 minutes to an hour. So it's easy, even though that seems like a long time, it's easy to get into a conversation that's hard to sort of complete when there's a little bit extra time available there. The technician can schedule follow-up visits, can bill for services, and do the initial documentation that the pharmacist can then review. And then when applicable, can complete patient satisfaction questionnaires for those people who are working on some special projects with PSW, or maybe other types of programs that require a patient questionnaire. And then following up on medication changes that are made that need to get faxed to physicians to make sure that that the loop is closed, because it does take a whole team. It's really hard for a pharmacist to do this program all by themselves. So it's great when it works, when everyone works as a team. One really important thing that we've seen work very well is that technicians can promote the program to patients. So many times there's somebody on the staff that just has a knack for marketing, and that's just sort of their personality and maybe previous experience. So putting somebody in charge of that is a really important piece to this. I always say, like, if you build it, they won't necessarily come. This is a program that requires a marketing focus and sort of constant attention to make sure that you don't forget about the program that you have the ability to provide. So folks can help to post marketing materials throughout the practice site, provide brochures to patients when applicable, when identifying somebody who you just think, wow, this person needs a little bit more assistance. Engage in conversation with the patients about this program, and we have a lot of information that we provide that helps with those talking points. Discuss the program in the community with friends, neighbors, and then be really ready to respond to patient questions and comments. So the technicians on the front line can be very, very helpful and instrumental in just having people understand what this program is about. So responding to questions like, well, doesn't my doctor already review my medications? And, taking that question very appropriately, and, talking about the complementary services that the pharmacist is offering, and that they're providing communication back to the physician on all fronts. And then simpler things like, what should I bring to my appointment? Those are all things that can be a team-based approach. The advantage to incorporating the technician into this work is, as I mentioned before, that using technicians to support and implement the program makes a pharmacy more successful at the WPQC program and other MTM programs that you might be working on for Part D in your setting, or for the CPESN program. And they provide more CMR visits and subsequently earn more revenue than those who don't. So the Medicaid program provides reimbursement for the comprehensive medication reviews as well as follow-ups. Part D plans offer reimbursement. CPESN programs are starting to offer reimbursement with a couple of different opportunities. So these really, if you can operationalize these programs and make them efficient, which I would argue includes using technicians to help make efficiency, then you can boost your revenue as well. And I think as described earlier with the immunization changes and other ways that technicians are becoming more active in the context of providing services in the pharmacy, that there's going to be more roles evolving for technicians in the future. So I'd like to switch for a couple of minutes over to talking about technicians and the concept of the community health worker. The community health worker, or CHW, is defined by the Centers for Disease Control as public health workers who serve as a bridge between communities, healthcare systems, and state health departments. In Wisconsin, we have health systems that fund community health workers, and we also have health systems via two what are called hubs in Wisconsin, one in Milwaukee and one in La Crosse, that support community health workers via their structure. And then grants also from the state and from CDC and from other smaller organizations are supporting the concept of having folks on the front lines that are helping to bridge community programs, healthcare systems, and the state public health work. So typically the community health worker is a trusted member of the community with a close understanding of that community that they're serving. So a community health worker, typically there's a type of training that they go through, a training program, but it may be maybe they're in a tribal community, maybe they're in an an African-American community, maybe they're in a Latinx community, and they speak the language, know the culture, and are really able to be more of that cultural broker that can, maybe they've experienced the issues that that their neighbors and community members are also experiencing. So this person ends up being a liaison between the health and social services opportunities and the community. They facilitate access to services, and then just to go on that further, improve the quality and cultural competence of service delivery. The reason we bring this up in context of technicians is that pharmacy technicians also play a critical role in bridging that gap, and can, I think, play an even bigger role in bridging the gap between health services and the community. I think technicians are already doing that on the front lines, in community pharmacies as well as health system pharmacies. So, I think many times technicians know the patients even better than the pharmacists. They're the front line. They can end up having the ability and time to talk with folks about their daily lives, and maybe identify with their friends and neighbors who are coming to the pharmacy even better than the pharmacist sometimes. So I think there's a role for the community health worker, and there are places in the US where the community health worker role is being utilized, and technicians are becoming trained as community health workers and using those skills to be able to help to serve patients better in the community pharmacy setting and help to connect community resources that are out there. So maybe there's housing resources or just community social structures that can be connected with, and that community health worker can help to be that bridge. So it's a new concept, but we're trying to get that concept out there, and would love to hear if anyone across the state is doing anything around utilizing the principles of community health workers with the technician. We'll probably be doing some more of this work and more promotion in the coming months for community health workers. But we just kind of want to bring up the topic right now. So if you have great things going on in your areas, please do contact us and let us know so that we can follow up and learn more. I want to show, here's one example. In the Unite Wisconsin, used to be called Unite MKE, but the Unite Wisconsin hub in Milwaukee, they connect underserved patients with community health workers, and then they use a software to guarantee that the community health workers are documenting specific pathways that lead to good healthcare outcomes. And they're doing home visits. The community health workers are doing home visits, and then by identifying the issues that would lead to better outcomes, they're coordinating care both at many levels. So they're helping to take that patient's issues and connect that patient back with prescribers, insurance, maybe there's case management that could help, pharmacists, social workers, and then other community support resources. So it's a really neat model, and I think they're seeing a lot of good results both in the Milwaukee area as well as the La Crosse area. So with that, I hope that you learned about WPQC potentials for technician certification, and maybe piqued your interest a little bit about community health workers. And we will close the presentation right now for additional questions. So back to you, Erica.
Thanks everybody for presenting. So we do have a few questions in the chat, and also anyone can ask more questions. We do have a few minutes here. So I'll just read what's been posed so far. So the first question was, does anyone know if or what the cost associated with Pass Assured is? And we do know the cost. It is $299 to purchase Pass Assured. And again, this is the training program for anyone who's a pharmacy technician who wants just generalized training, or who is trying to meet the training requirements in order to take the PTCB exam. So again, the cost is $299. However, there is an option to buy Pass Assured, the training program, and also sign up for the PTCB exam at the same time, and you can get those together at a discounted price. Our next question is the registration going to be required for all practice settings other than the high school graduate, any other training requirements? So Danielle, are you able to unmute yourself and share the answer?
Yes, absolutely. Thanks, Erica. So the first part of that question, is it required for all practice settings? Yes, it is. Regardless of your practice setting, and then regardless of your specific technician role, anybody working as a tech, whether you're a dispensing technician, a compounding technician, a tech technician, an immunizing technician, a combination of all of the above, plus your many other roles, all technicians, regardless of practice setting, will be required to register should that become law. And then there is not in the, excuse me, the registration bill, any additional certification or training requirements that would be required for technicians. Of course, the technician product verification and the immunization training requirements would still apply, but it doesn't require certification or any other specific training requirements.
Awesome. And Danielle, there's a new question in the chat that's related to the technician registration. So perhaps you could provide more background information. The comment and question say, I have concerns that the fee for the tech license, $60 is high. When I lived in another state, it was $15 to $25. My employer already does a background check. What does a license do in addition then? PTCB certification is separate. So I know these discussions have happened, so perhaps it might be helpful just to provide some more information.
Sure. So just to clarify, the $60 is every 2 years. So it does come out to $30 each year if you divide that by 2. We did look at all of our neighboring states, and $60 was the lowest fee amongst all of our neighboring states for that 2-year time period. And what a registration or a license would do that certification and a background check doesn't do is it gives the pharmacy examining board the authority to regulate the profession of technicians, meaning if a technician violates the Pharmacy Practice Act, whether it's through a violation that could cause patient harm or diversion of medications, any other violation that a pharmacist could currently have their license limited or revoked or suspended or be required to complete additional CE for, the pharmacy examining board would now have that authority over our pharmacy technicians. So it creates a slight barrier to entry. Our goal isn't to make it harder to become a technician, but our goal is really to make sure that we know who's being a technician, that the pharmacy examining board has the ability to remove bad actors from the profession, and that we can lift up the profession of pharmacy technicians by recognizing how important they are through a state legal recognition that currently doesn't exist.
Okay, thank you. So we'll go to another question, and Sarah, it looks like you responded to this one, but the question was, anything in the works to encourage certification for technicians? So Sarah, I don't know if you wanted to unmute and share any information.
Yeah, can you guys hear me okay?
We can.
Wonderful. So yes, we are definitely still hard at work encouraging certification. It's a very important part of technician professional development. And I know that we've helped support a lot of employers that have implemented certification requirements and also certification requirements for certain roles. And so the Technician Career Ladder program that Jane referenced builds in a discussion about, for these roles, we require this type of training or we require certification. There's many, for example, health systems now that require certification just for entry-level technicians. So we're definitely bringing people together to talk about the value of certification and how that can be incorporated into professional development efforts that an employer or team is doing at a pharmacy.
Thanks. And I think that sort of answers the next question here, which is, would being certified raise pay scale for anyone? And again, I think that's related to the discussion around technician career ladders and organizational approaches. So with that, I would welcome any other questions here over the next minute or two, but it does look like we may have answered all the questions that were in the chat.
Erica, I'll just add something else. This is Sarah again, while people are thinking of additional questions. And that is, technician workforce issues are front and center, a very acute challenge for Wisconsin pharmacy practice. And, every table and conversation we sit around lately dealing with pharmacy practice issues involves the discussion about making sure the technician workforce is adequate, can be retained, recruited, can perform the duties that help support pharmacist practice advancement as well. So it's really hand in glove with all of the efforts that we're doing related to pharmacist practice advancement. So we wanted to bring this webinar forward to members, technicians, and pharmacists alike to provide an opportunity to showcase where there is already opportunity to elevate technicians and move practice forward and provide efficiencies and serve your patients better. But we also know that there's real challenges related to workforce. Those go beyond, frankly, pharmacy practice. There's broad state level workforce challenges currently, and those I think are exacerbating what we're seeing in healthcare. So it's still very front and center for us. We've had recent conversations about how to help bring HR professionals together to talk about some of these challenges. PSW as an organization can help facilitate those conversations, but there's hard work that has to be done within individual organizations, and we understand that. So, just a special thanks to all of you who have joined today to really promote technician practice advancement as part of the pharmacist practice advancement effort that we're doing as a profession.
All right, and I think we might wrap up there. I am not seeing any other questions in the chat. So just a reminder, if you do have any other questions about the resources that we shared today, or just questions in general, feel free to email those to info@pswi.org, and someone would be happy to follow up with you. We will make this recorded presentation and also a PDF of the slides available, and that will be sent out through PSW Communications. So thank you again to our presenters and everyone who attended today.